Mary Free Bed Rehabilitation Hospital is a unique place. For over 100 years, Mary Free Bed has focused entirely on rehabilitation. Here, experienced caregivers will work with you, creating a customized rehabilitation program using the industry's best technology and expertise. Bright, cheery, and friendly with gardens to explore and comfortable rooms, you will immediately feel the difference. It's a special place, a unique place.
As far as I'm concerned, I feel like I work in one of the best hospitals in the nation.
I knew that this is the place I wanted him to be because I wanted him to get the best rehabilitation that I knew of. And that's here at Mary Free Bed.
We were fortunate that our doctors, the neurosurgeons, told us that his best chance of rehabilitation would be here in Grand Rapids at Mary Free Bed.
7 days a week, over 650 employees come to work here to do the one thing we do, rehabilitation. At Mary Free Bed Rehabilitation Hospital, you will find some of the nation's best physiatrists, rehab nurses, therapists, and psychologists. And our unique continuum of care ensures that the clinical team assigned to you on day one stays with you for as long as it takes.
Our rehab team is very interdisciplinary, like occupational therapy, PT, social work, rec therapy. We all talk together, as well as with the nurses and the doctors.
Each year, we see over 1,200 patients in our inpatient hospital and more than 40,000 patients in our outpatient center. We have treated hundreds and thousands of patients just like you. You will leave here with more independence than when you arrived. You will be able to do what may now seem impossible.
They just had dealt with it 1,000 times, and I was special. I felt that I was special, but I wasn't new.
Mary Free Bed's approach to rehab involves careful and continuous evaluation of each patient's capabilities, an understanding of their desires, and a customized plan to help every patient reach their new personal best. And along the way, you will get the encouragement you need.
When Kyle first came, he was in a lot of pain, and it was hard on me seeing him that way. He had a brain injury, so he didn't really, wasn't comprehending everything, and they just explained things to me to help me understand what he was going through.
The most satisfying thing here was knowing and finding out how caring and how persistent the therapists were with me and never giving up on something and always coming up and pushing me to do better and knowing I could.
I can remember having confidence in the treatment that I was receiving and thinking, these people know what they're doing. They've seen this before, and and just the way that they treated me was in such a calm, compassionate, they knew, and it was very reassuring, and that's when I started to be able to relax.
Our staff have that realization. They know that the son or daughter that they're helping, the mother or the father that they're helping, could very well be their son or daughter or their mother or father. And because we have this opportunity to spend some time together, you develop a really deep feeling for how your patients turn out.
I think they truly do think about their patients after hours and try to come up with new, innovative ways to get things to work or what they respond to.
Families are welcome here. They are indispensable in emotional and practical ways, and we encourage their involvement. If they're the primary caregiver, they will learn skills to care for their loved one confidently and capably.